This is the high school presentation on concussions and CTE by Hannah Black. What is a concussion? A concussion is caused by a TBI or traumatic brain injury. A traumatic brain injury can be from a bump, bolt, or blow to the head that causes the brain to move back and forth rapidly. An MRI or CT scan can be used to detect bruising or bleeding in the brain. However, only a neurological exam is used to confirm a concussion diagnosis. Here's a little concussion video.
A concussion is a type of traumatic brain injury, or TBI, caused by a bump, blow, or jolt to the head, or by a hit to the body that causes your head and brain to move rapidly back and forth. This sudden movement can literally cause the brain to bounce around or twist in the skull, stretching and damaging the brain cells and creating chemical changes in the brain. What you might not know is that these chemical changes make the brain more sensitive to any increased stress or injury until it fully recovers.
Okay.
A concussion.
So the brain, a little information about the brain. It is surrounded by CSF or cerebral spinal fluid to protect it from damage. The CSF is in the skull, like in the previous video, protects it from hitting the skull walls. But a concussion is caused by the brain hitting the walls of the skull. Traumatic brain injury can cause bruising, also known as a contusion, and swelling of the brain due to the trauma of hitting the skull walls. So, signs and symptoms of concussions. Some include headache, feeling pressure on the head, nausea, feeling car sick-like or vomiting, dizziness and balance issues, light and noise sensitivity, feeling sluggish or groggy, having some brain fog is another way of putting that, confusion and memory loss, or feeling down or depressed. Some concussion testing tools that doctors and nurses may use. A neurological exam, they'll assess your strength, reflexes, coordination, balance, hearing, sensation, mental status, and eye exams. And some cognitive testing they may do is testing memory, what you recall from the incident of hitting the head, recallability, so they may say a few words, ask you to remember them at the end of the assessment, and assess your ability to recall those 3 words, or however many they tell you, and concentration. Some treatments for concussion. There is really no medicines used to treat a concussion. It's mainly rest and sleep. That is the most important. The only way your brain can recover is in its sleep, when you're in the sleeping state. So no reading for long periods of time. This can cause strain on your eyes, causing headaches, as well as limiting TV and phone use. That blue light can cause strain on your eyes and hurt your brain, give you headaches and migraines, can even cause you to feel a little nauseous. No sports. You want your brain to be fully healed before you do any sort of activities. At least 1 week of no school and work is usually what doctors will recommend. They will write a school or work note. They want you to take a week off just for rest, because that is the most important treatment for concussion. And both physical and mental rest. So physical, no sports, and mental rest. You want to have no stress. Stress can cause more harm to your brain, and limited activity. What is a CTE? CTE is chronic traumatic encephalopathy, which is a brain disorder caused by multiple head injuries. Degeneration is the death of nerve cells in the brain and will worsen over time. Some symptoms of CTE are kind of similar to symptoms of a concussion or dementia, Alzheimer's. So this includes memory loss, confusion, impaired judgment, impulse control problems, aggression, depression, anxiety, suicidality, and eventually progressive dementia. So this can be you just feeling a little off, not yourself, These can all be symptoms of concussions and CTE. It may cause physical limitations or impairments as well. So, like we mentioned earlier, concussions and blows to the head can cause balance issues or strength reflex issues if it is a severe concussion or CTE. A high percentage of football players are diagnosed with CTE. They have a lot of head blows in football games and practices, and there's been a lot of studies, and one from Boston University found that 91.7% of football players that were studied in their control group were diagnosed with CTE. How is CTE diagnosed? Well, CTE can only be confirmed after death through a brain tissue analysis. CTE is not reversible or curable. So you see on the left side, that is a normal sized brain. It looks good, healthy. On the right side, we have very advanced CTE. So you can see there's a lot of degeneration, and brain cells and brain nerves, once they die, they cannot be regenerated. So you see that advanced CTE, once it is advanced, it cannot go back to that normal brain size. So some risks for CTE include having multiple concussions or blows to the head, contact sports such as football, boxing, wrestling. Lots of military veterans are found to have CTE. And even domestic violence and abuse, that intentional injury can be contributed to CTE and concussions. Not all head injuries will lead to CTE, but all those risks we mentioned earlier increase the chance for developing CTE and having those symptoms like confusion and dementia. So, how can we protect our brains from concussions and prevent the development of CTE? So, number one, protective gear. In sports and football, you want to make sure you're wearing your helmets, all the right protective gear. If you're riding your bike, wearing your helmets. Techniques to avoid blows to the head. And sports techniques, maybe direct blows to other parts of the body instead of the head. Limiting the amount of contact during sports practice. So we see in football, there's a lot of blows in games, but limiting that amount of contact during practice can prevent the amount of concussions athletes can get. So the 3 R's for concussions is recognize, report, and recover. Recognize that you have a blow to the head, you have injured your head. Report to your sports coach. Report to your parents, report to your doctor, and then recover. That rest and sleep is very important for recovering your brain. And how do we strengthen our brains? Diet and exercise is very important, having a healthy lifestyle. Some brain foods include nuts, seeds, salmon, blueberries, dark leafy greens, lean red meat, avocados, tomatoes, whole grains, brown rice, dark chocolate, and quinoa. Those are just some of the very beneficial foods for your brain. Getting plenty of sleep, like we mentioned earlier, sleep is the only way your brain will recover. Sleep and rest is very important for recovering from concussions and also preventing stress. Remaining socially involved. Limiting caffeine intake. Caffeine can cause damage to the brain. It's a stimulant, will keep your brain awake and preventing it from resting. Reading, studying, and playing games. Those are very good for cognition and memory. Limiting alcohol intake, like I mentioned earlier. Once a brain cell dies, it cannot be regenerated, and alcohol does kill brain cells. So protect your brain. So now we have some questions. Question number 1 is, what are some signs and symptoms of a concussion? The answer is headache and pressure on the head, nausea, vomiting, dizziness and balance issues, light and noise sensitivity, feeling sluggish or groggy, confusion and memory loss, or feeling down or depressed. Question number 2, what does CSF stand for and what is its purpose? The answer is cerebral spinal fluid. This protects the brain from damage and hitting the skull wall. Like we saw in that video earlier, the back and forth movement of that head very quickly. The CSF may not be able to protect it from that, and that's what causes a concussion. Question 3, true or false? A CTE can be diagnosed using neurological exam while a person is alive. The answer is false. A CTE can only be diagnosed after death by an autopsy of the brain. Like, remember we saw in that picture earlier, the healthy brain and the CTE brain. Question number 4, true or false? If you hit your head, you will get CTE. This is false. Not all head injuries will result in CTE, or you may have many head injuries and not CTE. Question 5, true or false? Staying up all night is good for your brain. False. Getting a good night's sleep and good rest is healthy for your brain. And that concludes the presentation. Thank you.